Our next speaker is Dr. Victoria Pelak, and she will speak on visual snow and the visual system, what we know and don't know. Doctor?
So I'm Victoria Pelak. I'm a neuro-ophthalmologist. My background is in neurology, so I'm neurology trained, and I see patients at the University of Colorado School of Medicine. I also have a special interest in what is called behavioral neurology. That's another subspecialty of mine, where I study cognitive and behavioral changes related to visual brain function. So I have a very strong interest in visual brain function, and that's one of the reasons why I'm here. And I thank Paul and Sierra, as well as Dr. Goadsby, for having me here today. So I am going to talk about the visual system and sort of map what we know about visual snow symptoms onto what we know about the visual pathways. And I think we've had some incredible information presented to us by Jim and Joanne all about what we are understanding about visual snow. And now I want to take that information that they presented to us and sort of add that on to the visual pathways. So we have some proposed criteria from Shanken et al. In 2014 that tell us that if we diagnose you with visual snow, we typically are going to try to follow these criteria, which is visual snow symptoms with two or more of the following: entoptic phenomenon, palinopsia, photophobia, and nyctalopia. And these symptoms, these three symptoms that I've highlighted, which are the visual snow symptoms, entoptic phenomena, and palinopsia, are really what I'm going to try to map onto the visual system. And in doing so, try to give you a better understanding of what we are able to understand about the areas of the brain that might be causing the problem. Specifically, I just want to briefly introduce the terms that many of you probably know already, but also to explore them a little more in depth, but I want to give you a preview of what they are. So entoptic phenomena, and you've heard about those already this morning. These are really the visual experiences you have from internal eye stimuli. So when you see floaters or you see structures within the eye itself or flashes of light, those are what we refer to as entoptic phenomenon. Palinopsia, this is really a persistence of a visual image, and this persistence can come in the form of seeing trails or seeing an after image of what you look at. And then photophobia, of course, we know as very light sensitive, and then impaired night vision or nyctalopia. Those are two that I'm not going to map onto the visual system for you today because of the interest in time, and because by talking about those first three, it really highlights some of what we've heard from this morning. And just to briefly mention too, is by coming together from so many different fields, people with Jim's background, people with Joanne's background, to be able to have this type of teamwork in trying to solve a problem is extremely important. It's one that's being recognized by funding agencies all over the world, really, but particularly NIH, that team science is really important. To be able to solve a medical problem, we've had hundreds of years in attempt of solving medical problems, and seemingly, especially as a patient, you probably feel like we haven't gotten very far. So what the thought is now is by working in teams with expertise that come from completely different backgrounds, such as Jim's, for instance, versus mine, totally different backgrounds, but to hear him talk about his thoughts and understanding based on his background is very different than hearing somebody from my background and we all working together who are just neuro-ophthalmologists. So bringing these teams together are really going to be a way to solve this as well as other major medical problems. So you've had a bit of an introduction to brain, and now I'm going to dig in deep a little bit. And this is the representation of the cortical regions of the brain, or the brain cortex. And it's the wrinkly part of the brain that we kind of grew up learning about back in elementary school. And you can see it sort of set aside into different areas. First, the frontal lobes, or the frontal regions of the brain that you can see in blue. The green region there, temporal lobes. And the back part of the brain, referred to as the occipital lobe, that's where all that visual action happens. And then the parietal regions, they're up top a little bit. And again, we're going to be talking a lot about the occipital lobe, but certainly a large part of the brain goes to processing visual information. So it's not just within the occipital lobe, but that is referred to, the very back part of the occipital lobe is referred to as the primary visual cortex because of the way it looks under the microscope. And you heard Jim talk about the primary visual cortex not really being primary, and he's right, because so many other areas are really important for visual functioning, but that's the term that's used because it's the first area of the cortex that is processing images. So next, we're going to talk about these pathways that you've already had an introduction to, but I'm going to review them just very briefly. We know that about 80% of our sensory experience really comes through the eye itself. And so obviously a very important part of our day and world is vision. And when we experience vision, it really comes into the eye or into the retina in the form of light and light wavelengths. So everything that we see is represented by a wavelength that's then picked up by our retina. It enters through the cornea, that surface part of the eye that we all know about. When you touch it or when anything touches it, it hurts. That's the cornea. It goes through the lens. That's the part of the eye that's right behind the cornea that we have as we get older. That's the part of the eye that develops a cataract that's removed and a new lens is placed so that you can see more clearly. And where all the nerves are in the eye that processes these wavelengths that come in are really within the retina. The retina is like a layered cake, and it's filled with millions of nerve cells that process these wavelengths. And then it sends those wavelengths that it's received in the form of electrical chemical transmission through the optic nerve into an area that you've heard about this morning called the thalamus. And there it stops and sends off its signals and says, here's the information we just received. Now you are the next person in the relay system. You take off running with it and do what you will with the information we're giving you. So then the thalamus picks up the information and sends it back to the visual cortex. And this is not the only pathway that the thalamus takes. It also sends information that is what we refer to as non-image information, as well as information that you may not be consciously aware of. And to give you a little bit better understanding about why we all now know that visual snow is not in the eyes, we're going to have this bird's eye view. And if you look at this bird's eye view, you'll see that the two eyes take in their information separately, but then they come together in an area of the brain called the optic chiasm. And that, again, are these nerve cells that come from the eyes. They mix together. And then half of the world that we see is sent to one half of the brain, and that comes from both eyes. So the right half of the world is sent to the left half of the brain, and the right half of the world is sent to the other side of the brain. And so what we know is that if we're going to injure the left half of the brain in the occipital cortex or even along these pathways, then the other half of your visual world is not going to be able to see that well. So what Jim was talking about is that we can't find this problem for visual snow being within the eyeball itself or even in some of the earlier areas. It has to be where parts of the brain are responsible for understanding what's happening throughout the visual field, not just in one half of the visual field. And the other thing to keep in mind is that once this information is received by the brain, it is sent back to areas in the thalamus. It reports back and probably reports back very important information about what you should pay attention to, or as what Joanne talked about is important information that we refer to as salience. So salience of your visual world. And that's not where it ends. There's other areas that are right outside the primary visual cortex, higher cortical regions of the brain that also report back, that are extremely important to be able to tell us where to pay attention to, what to ignore, or sometimes we won't even see what's happening around us because our brain is ignoring it for us. So we know that visual snow is throughout the entire visual world, and that's why Jim was really focusing on the fact that this can't be at the level of the eye, the optic nerve, or even these fibers that send information back to the primary visual cortex. And it certainly can't be in just one side of the brain in the visual cortex, because that would only involve 1/2 of the world. So that's why we know, and what we can add to our body of knowledge right at this point, is that there has to be some higher areas of the visual cortex and potentially these thalamic regions, because these thalamic regions also monitor, certain parts of the thalamus monitor the entire visual field. And one area is called the pulvinar, and that's very important for understanding what to pay attention to. And so what do we know from everything so far, and what I just presented to you is that visual snow is really beyond the eyes and involves higher order visual regions of the brain, not just the visual cortex, but likely the thalamus as well. So what about these entoptic phenomena? What does this have to do with the brain? And as you heard from Jim, is that this really, entoptic phenomenon really have to do with you seeing things within your eye. And if we started just with floaters, 80% of the population experiences floaters. And I just depicted them here as a blob, a squiggly line, as well as a larger squiggly line. And these things actually float around. They're pieces of our vitreous that have detached from the retina, and they literally float. We also have blood cells that are constantly moving throughout our blood vessels. And all of these things, along with flashes of light that are due to mechanical stimulation of the back part or the retina, all of these things are sending signals, and sometimes those signals make it to your consciousness and sometimes they don't. If the signal's too weak, they won't. But there's other reasons that these signals might not make it to the back of the brain, and we're going to talk a little bit about that. But basically, entoptic phenomenon are normal, healthy, physiological things that occur in all of us. And about 80% of us, as I said, will experience floaters. And in that sense, we know that this is a normal physiology. But why with visual snow are we constantly attending to it, or those with visual snow are constantly attending to it or noticing it? So let's step back a moment and just talk about retinal nerve cell impulses. We know that retinal nerve cells are constantly firing. This can be done at random. So at random, your retinal nerve cell may be just sending off a signal. And of course, you don't want to pay attention to that. And there's regions of our brain that tell us not to pay attention, or the signals are too weak. If the signal's strong enough to make it all the way back to the visual cortex might send a message back to the thalamus and say, no, don't pay attention to that. That's not important. That signal wasn't strong enough. However you want to put it into words, but that's basically what the brain does all day. And these insignificant stimuli that occur within our eye, I mean, sometimes they're actually quite significant, because if you have a retinal detachment, you'll have flashes, you'll have floaters, and you need to get to somewhere quickly to have that fixed. And so sometimes they're not quite insignificant, but by what I mean, what I mean by insignificant is that if we constantly pay attention to that, it's very difficult to pay attention to anything else. And so we might consider this we might term this noise, the noise in the visual system, which again can happen randomly, it can happen for important reasons, or it can happen for insignificant reasons. So if you have a nerve cell within the retina that's sending those signals to the thalamus and saying, hey, here's something that's happening, let's pay attention to that. We need networks in the brain to tell us, no, let's not pay attention to that. Or, yep, I've got the signal, but I'm going to move on and focus on what I need to. And so we think what might modulate this is the connections between the thalamus and extra primary visual cortical regions, so those higher order visual cortical regions. And that modulation is really important. And so one possibility is that that modulation is what might go wrong with visual snow, or why visual snow occurs, is sort of this lack of ability to modulate some of these signals. So the thalamus connections with the visual cortical regions modulate attention and prevent noise. And so you see, as the light comes in, goes into the retina, travels through the optic nerve, we have to have something there that tells us what to attend to or not to. And we saw some very elegant experiments demonstrated today that shows that there is something to this idea that there may be some problems with modulation. So this was to remind me, to let you know again, that the visual cortex just doesn't receive information and pass it on to different parts of the brain. It sends information back to those deep areas that received it from the retina, which may hold a key to understanding what we're dealing here with. So what's a second thing to add to our what we know list? Well, regarding entoptic phenomena, we know that connections between the thalamus, and it potentially may have a big role for the pulvinar in this, because the pulvinar does appear to be very important in looking throughout the visual field, not just in pieces of the visual field. And the visual cortical regions outside that primary visual cortex that modulate attention to internal visual stimuli. And there may be something going on with the modulation that prevents the appropriate modulation that we all have when we don't have visual snow. So palinopsia, which is nicely demonstrated from Dr. Goldsby's Brain 2014 paper, is really this trailing of image that you've seen or that's moving, so an object that's moving, or an after image of something that you've looked at. What do we know about palinopsia when it doesn't occur in somebody with visual snow? Well, we actually have a lot of information about palinopsia from people who have strokes, seizures, brain tumors, true lesions in the brain. And those effects tend to occur after injury to the higher visual orders of the brain, called the parietal and the posterior parietal regions, as well as the temporal regions in the posterior. There's very regions that we talked about as being important for vision, but out of the primary visual cortex. So we know that sometimes after surgery, sometimes people who have a head injury that injure those regions of the brain will experience palinopsia. And if you study certain conditions, you learn that palinopsia is a condition that tends to be very specific for these visual regions of the brain. It can happen with certain prescription drugs or drugs that are non-prescription drugs, and we have a lesser understanding of where that's happening in the brain. And so a lot of our information really comes from understanding what happens after lesions or injuries to the brain. And if we look at people with palinopsia, we think this is a hyper-excitable state, meaning there's areas of the brain that have persistence in that signal. And I talked about having a signal being sent from one neuron to the other, and that's what we think may be continuing to happen with palinopsia, is this signal is constantly being produced, maybe at a weaker level, and maybe even from a different area of the brain. Once the visual area of the brain has sent it on to other areas, maybe there's a weak signal that's continuing, but we call this hyperexcitability. And you heard a little bit about that today in the evidence that we're finding on a clinical basis for hyperexcitability in visual snow. So visual snow syndrome as a cortical hyperexcitability syndrome does have some evidence, again by Dr. Goldsby, where they saw an area of excessive metabolic activity in people with visual snow while they were essentially at rest. And this higher order visual region is within the temporal lobes in an area called the lingual gyrus. And this area is extremely important for processing visual information. And so it doesn't seem to be any accident that we're finding hypermetabolic changes or potentially hyperexcitability in this area of the brain in people with visual snow. And by the way, it's very difficult to study hypermetabolic changes within the thalamus itself for a number of technical reasons related to brain imaging and neuroimaging. So just to point out that hyperexcitability, I guess I added a few animations with that arrow, so I'm going to try to move on here. So how do we summarize? So we're going to add to those 3 things that we just talked about what we know. We're going to add now that higher order visual cortex seems to be hyperexcitable in visual snow. And now we have a lot of behavioral evidence that was discussed today as well to show that there is something to this as a very potential and real state that the brain is in with visual snow. And in summary, just to talk about what we don't know, which of course is very difficult to talk about what we don't know. It's hard to know where to start because we don't know a lot. But just to summarize, obviously we don't understand the mechanism of some of these things that I was talking about, the hyperexcitability mechanism. Why does it happen? Why does it come on as a lightning bolt? Hearing stories from patients where and I've heard it since I've been here yesterday, of talking to people with visual snow, is that they know the exact date that it happened. So it really happens like a lightning bolt in people who acquire it out of childhood or don't have it when they're born. And why does that happen? We don't understand, and certainly don't understand how to cure it. But I hope with some of the rest of the speakers today, you really hear that there is a reason to be hopeful, especially with conferences like these and bringing together so many people from different disciplines, as I talked about at the beginning, and how important it is to hear from the patients of exactly what they experience. Just by hearing that there are 97% of people that don't experience any color in their visual snow sometimes allows us to pinpoint the exact regions of the brain that may be involved. So as Jim mentioned, and when he takes these surveys and provides us that type of information, we may be able to eliminate certain areas of the brain that may not be involved in visual snow. So part of the teamwork is not just from engineers, neuropsychologists, neuro-ophthalmologists, it's also from the patients for sure. So I want to thank you for your attention, but also thank the wonderful colleagues that I have at the University of Colorado. I have the distinct honor of working both in the neurology and ophthalmology departments, and it's really a pleasure to work with them, and it's been my pleasure to be here today. Thank you so much.